Welcome everyone, I'm Dr. Haidaria from Harley Street Dermal, and today we're explaining the cheek structure and smile line softening aspect of the feminization treatment. So we have a lovely client here, and we've already marked up, we've already created the lines to show us where we're going for the smile lines. She's got some kind of like medial dentation of the cheek here, so the separation of the malar fat pads here, and we want to just lift the cheek structure and just give it a bit more volume and a little bit more definition without making it look very obvious. We want to keep it as natural as possible. We've got this marked out on both sides. So to start with, we're going to just try and lift up the cheek a little bit. So I'm going to do a very small entry point for the cannula. Tiny sharp there, well done. And now we're going to feed the cannula through. There we go. Just a little bit of pressure here. Just finding our way through so you can feel the cannula. Shouldn't be too painful, but one will be aware of its presence, and warning of a bit of discomfort is always helpful. So just doing small threads of filler here. Just another small bit of threads, a little bits of filler at a time. Just going in retrograde injection technique, so it just means injecting backwards as you go along. Okay, brilliant. And then what we'll do is we'll supplement that with some deeper injected filler to the periosteum, so to the lining of the bone. That's just to lift out the cheek, to keep it lifted without making it puffy. And it's helpful to pinch above and below to prevent the filler from dispositioning above or below. That will provide some lift and some structure. And then what we'll do is we'll do a little bit of lift on the outer part of the cheek, so following the zygomatic bone and the zygomatic arch, which is the cheekbone that you feel. So I'm going to ask you to turn a little bit to the side, Sophie, thank you so much. Tiny poke here, just to create the entry point for the cannula, well done. A little bit of pressure, and we're trying to go a little bit deeper with this, because the filler that we use here is quite thick, so if you inject it superficially, it can cause a lot of water absorption, edema, which leads to lumpiness and puffiness. So the deeper you inject within the fat tissue, the less likely that will happen, and the more likely you'll get a gentle lift rather than a lumpy appearance. And it's important just to fan across the cheek to cover the scope of the bone. Now we're going to switch to doing the smile line on this side. So we're going to create a small entry point again, so we just feel, so it's important to see that with the smile line you can see the line. And if you're ever not sure, it's just squeezing the two together, you'll get your trajectory, and then we can measure up our cannula, and then we just create an entry point, small sharp, there we go, lovely. And even simpler, we just go in through the entry point. And this one's a little bit uncomfortable, so it's always important to warn patients that this one can be a little bit more uncomfortable than the rest. As you enter near the nostril area, you can feel the cannula there. And you just do, again, small injection in a backwards motion, what we call retrograde threading. Well done, you're doing great. This is just to soften the impact of the line. You don't want to get rid of it completely, because it can end up looking puffy if you over-inject this area. So it's just a case of softening more than anything else. And then we'll repeat the other side.